These narrated slides are intended to save you the hassle of reading through an extended set of slides. Please consider this to be a short course on the pharmacy software used to address the adherence dilemma in Aldawa. When accessing your system, please log in with your provided details. Please contact the call center supervisor in case of forgotten passwords or login problems. Prior to the pharmacist's customer care actions, the call center has already contacted patients who are due for a chronic dispense and have taken their order. As the pharmacy of the patient's choice, you will see which patients agreed to order their medication from yourself. The orders will now show as pending, meaning the order is taken, but the medication is not prepared for collection yet. The next step is to pick and pack it so that it may be ready by the time the patient arrives. You will be able to see which medication was packed, but not collected yet. After logging in, you'll see patients with whom there has been interactions around filling their chronic scripts. After the call center took an order, the script is flagged or the order is flagged as pending, and it becomes visible to the pharmacist for the first time. The pharmacist can change the status of the pending order to packed, which means it is now ready for collection. Once the patient arrives, the order status can be changed to collected, which means that no further actions are necessary for this patient. You can filter for each status with a drop-down menu at the top of your screen. If for some reason the order cannot be prepared, the pharmacist may assign a service exception status to the order. An example might be that the product is out of stock and needs to be ordered in. Also, if a patient does not collect and phone calls to the patient does not succeed in getting the patient to collect, the order may be reversed. By clicking on the patient's name in the task list, it will open up the patient's specific order details. Everything about the patient will be on the left-hand side of your screen. Everything about the order will be at the top, and everything about interacting with this customer will be at the bottom. The patient will be assigned a status by the call center. An order may have several products that were ordered. It is possible to pack all the products and therefore the whole order will be marked as packed. However, if only 3 or 4 products are available, some products will not be packed, although the rest of the order will be packed. Therefore, it is important to update both the individual products and the complete orders as status, especially for patients with multiple chronic drugs like this one. The system automatically prompts the pharmacist to select the order status after selecting each line's status. In case an item is out of stock, then select the relevant option under Service Exception. Click on Update Order and respond if the system prompts you for an order status update. It is important to contact the patient and inform them of the situation and your action plan to deal with it, such as ordering stock in. Remember to agree a new collection date with the patient and to record it on the system. In case a customer do not collect their package, reverse the order by selecting Reversed and Customer did not collect. Select Reversed and Customer did not collect as the reason. The patient's order will now disappear from your task list screen. Below the patient's lines that were ordered, previous customer interactions are shown. Note fields allow the call center to keep record of patient specifics, and it is also visible to the pharmacist. The pharmacist can also add notes for reference later by himself or the call center. On the Order History tab, previous orders by this customer will be displayed. By hovering the mouse pointer over the order, the previous items will be displayed and whether they were packed, reversed, or collected. If a patient reports an adverse drug reaction, select the ADR tab and complete the ADR accordingly. The call center will change the customer status to active if they agree to be on the service. If a patient tells the pharmacist they don't want to be on the service, you can change the status. Change the status to declined. Patients that have not been on the service are new. Once they agree to become active on the service, they get the active status, and if they refuse the service, they are declined. If they decline, please select whether they decline the program or the pharmacy. If they don't want to buy from the specific pharmacy but might buy elsewhere, they are declining to buy from this pharmacy. If they don't want to have the service of being called and having their parcel prepared for collection, they are declining the program. The system will prompt you for a reason. It might be cost or that another pharmacy is closer if you decline that they will buy from your pharmacy. If the patient elects not to be on the adherence program, please select a reason. This will offer valuable market insights to Aldawa. The patient's contact details might change and can be updated on the left-hand pane. Click Edit or update the contact number or email address, and it will prompt you to do so in a pop-up. In the unlikely event that the patient reports an ADR, please record it by using the ADR capture box.